My name is Liz Plosser. I am the former editor-in-chief of Women's Health. I am a mom to 3 kiddos. And most of all, I am a big believer in women owning their health journey, especially in midlife. As an advisor to Alloy and as a 46-year-old who is proudly navigating perimenopause myself, I am so excited to be here with you all today for a conversation that is at top of mind for so many of us, midlife weight gain. We are going to get into the science-backed options that are finally starting to meet women where we all are, because at Alloy, we firmly believe that you should feel amazing in your body. And we're here to offer the information, support, and science-backed personalization and solutions that you need from our menopause doctors that are tailored just for you. I am so happy today to be joined by the brilliant Dr. Disha Narang. She's a leading endocrinologist, obesity and culinary medical specialist, and the Director of Obesity Medicine at Endeavor Health Systems in Chicago. She graduated with a medical degree from Vanderbilt University School of Medicine and completed her residency and endocrinology fellowship at the University of Chicago. I used to live in Chicago, so this all makes my heart happy. She believes in educating and empowering patients and communities, and that it's the best way to prevent long-term metabolic disease. Dr. Disha loves working with women at all stages of their lives, in addition to families navigating obesity and chronic disease. So our goal today is to cut through the noise and provide clear, actionable, and empowering information, covering everything from the changes happening in our bodies as we age to what treatments like GLP-1 medications can and cannot do. And just as importantly, we want to hear from all of you who have joined today. What's on your mind? What questions do you have? And what support do you need? So please make sure to drop questions that you have into our chat. And I promise that we will get to as many as possible after I've spent some time asking Dr. Narang about some of the topics and questions that we get every single day at Alloy. All right. I also want to add that for any of you who might need to pop off early, please don't worry. We are recording this session and we will be posting it to our YouTube page within about 24 hours after we finish up today. And with that, I am absolutely thrilled to dive in with you, Dr. Narang. Let's start by, hello. Let's start at the beginning, midlife, metabolism, and weight. So a lot of women, as we know, gain weight or notice that they are during this chapter of their lives, especially in the belly area, even if nothing else is changing in how they eat or move. Can you explain what is happening?
Yeah, this is such a common complaint. And one of the things that I always tell my patients, because this is something I see literally every day in clinic, is that you're not alone. And this is very much a part of just body physiology. The other thing I often say, and I think it's very true as well, is that every 10 years, there's just some nonsense going on in a woman's body, right? Either you're, in your teens and like you're going through puberty, potentially, prepartum, postpartum, perimenopause, menopause. There's just some craziness going on in our bodies, and so much of it is with hormone changes, right? And it makes it really hard to get weight off, every 5 to 10 years that you age. And so most of the time, the patients that I'm seeing, it's not due to a lack of effort, right? Every single patient will tell me, it's not like they're out at the drive-through every day or, trying to eat processed foods and things like that, most of the time anyway. And so it's certainly not for a lack of effort. However, that effort should not be in vain. And that's something that I really want to just emphasize, because I think it's really frustrating when, you feel like you're doing everything you should, and that belly fat and things are not coming down, right? And the reason that happens is because our estradiol levels are going down, right? And so that causes, it's all perspective, but relatively the testosterone levels actually do go up, right? But that's just it's not actually, but like when you look at it in ratios, it makes it look like the testosterone levels are going up. But with that change in the estradiol, the drop in the estradiol, drop in the progesterone, that's what causes that accumulation of the belly fat. And that is directly tied to insulin resistance. So that visceral adiposity is something that, especially from a weight management perspective, we really should work on targeting, because that not only, obviously, people don't love the look of that, but the other part of it is that that's also a sign of metabolic disease, right? So it's insulin resistance, increased inflammation, it increases, cardiovascular disease risk. And so that is something that, we are actively targeting. And so from the outside, that's what our patients are seeing. But from the inside, there's a lot going on because of that as well.
Thank you. That was super helpful. I was going to ask you about what's going on with our hormones during this shift, but you got right there, which I think is super helpful to understand that some of this stuff is just most of it is just the physiology of our bodies, and
Yeah,
that's the magic of the human body, and it can be magical, but it can also be frustrating at times.
exactly.
I also love that you pointed out these healthy lifestyle habits. So for anybody who didn't hear Dr. Narang loud and clear, all of your dedication to eating healthy, prioritizing protein, fiber, lots of fruits and
Right,
vegetables, as well as movement. They are all doing really powerful, healthy things in your body, even if that belly fat and other frustrating weight
right.
stuff is happening.
Right. It's yeah, it's just, I think it's really hard to see results sometimes, and that can be discouraging, depressing, and then that starts to weigh on people's mental health and, all of that. And so it's not your fault. I would blame body physiology and hormones, right? And the other part of it is that, this is why I think, Alloy as a platform is so valuable for women going through this phase of life, because I think a lot of women are just sort of told, like, you just have to get through it, suck it up, like, and it doesn't have to be that way. And that's where we have tools that can actually help.
Awesome. For those of you who are not aware, which many of you probably are, but just to put it out there, Alloy is a menopause platform that has menopause trained doctors who are helping women during this chapter of their lives, perimenopause and menopause. So they can offer support, advice. There's tons of great content to support you, and also doctors will meet with you one-on-one to discuss what's going on in your body, whether it's needing some extra support with hormones, or, as we're about to talk about, even weight loss medications. And with that, let's get into the hottest topic that there
Right.
might be under the sun in 2025, which is GLP-1s and medication support. No doubt everyone who tuned in today has heard or seen the headlines around this, but it's very rare that we get access to such an accomplished and experienced doctor. So thank you again for really getting nitty gritty with us.
I love talking about this
I
stuff.
love it. Me too. You're in the exact right place then.
Yes.
So let's talk about GLP-1s. What are they, and how do they work to support weight loss and metabolic health?
So GLP-1 is a hormone that we all have naturally. The medications, however, I would say basically make that hormone a bit more powerful. So it's called a GLP-1 agonist. Um, and so basically it enhances our own hormone function. And with the medication, it potentially allows for, greater concentration in your body. And so the way that these work, there's just so many facets now, right? It's not just in the world of weight management. So we've been using GLP-1 agonists since 2005. And so we've actually had these in use for 20 years. But I think, with like social media and the press and everything, they've just become extremely popular and high demand in the last couple years. And so it's led to shortages and like all of this stuff. But we have a lot of experience with these medications. So they started off in the diabetes world, and in the last 6 to 8 years, they are now FDA approved for weight management. And so, a lot of patients with type 2 diabetes may have obesity. Not all patients with obesity may have type 2 diabetes. However, the risk is significant. And so what, we had noticed in our patients with diabetes was that it was really helping to improve blood sugar. So when we're talking about how they work, it helps with glycemic control. And so it helps to obviously lower blood sugars and A1Cs. It also works from a hunger and fullness standpoint. So it works at the appetite center of the brain, or the reward center. And it also slows down gastric emptying to make somebody feel fuller faster. Now we've seen benefits to the heart. We're seeing benefits to the kidney. There's studies in place right now, so we don't have FDA indication for this yet, but we're seeing improvements in liver. We're seeing improvements in patients with PCOS. And so, we've seen so many various benefits of GLP-1. A lot of it also has to do with anti-inflammation, right? So as somebody loses weight, that's also anti-inflammatory in and of itself. But the way that this helps to support weight loss, and I'll come away from the blood sugar part of it, but it suppresses the hunger hormone. And so what it does is that it decreases the stimulus of the hunger hormone in that reward center of your brain. And so it decreases that food noise that we hear about a lot now in the media. But with the gastric emptying, with the slowing of the gastric emptying, you also feel fuller faster. And so with kind of this twofold, working with suppression of these hormones and the decreased impulse at the brain level and at the gut level, this is where we're starting to see weight loss. And as we lose weight, we do support metabolic health, right? That helps to lower people's blood pressures. It helps to lower cholesterol, helps to lower diabetes. And when we lower all those three things, and actually improve sleep apnea, but when we do improve all those things, we decrease the risk of heart attack and stroke. So cardiovascular disease is sort of the big thing that we're trying to avoid.
Amazing. Yeah, I feel like I'm seeing in the news, because I follow this space so carefully. There's new studies coming out really frequently these
A
days
lot.
about
Yeah.
all
Yeah.
of the added benefits that actually have nothing to do with weight loss, which leads me to the question, are there any risks that women should keep in mind?
Um, in terms of risks, I mean, with side effects, the more common side effects are GI related. Some people could feel fatigue. Some people could have kind of a lowering of blood sugar, so they might feel mildly hypoglycemic, but those are actually more rare. But GI is kind of more common. However, based on the studies, with both GLP-1s and there's another medication, GIP, GLP, which is tirzepatide, in both the studies, about 95 to 96% of patients actually at the end of the day, even at the highest doses, are able to tolerate these medications. And so, of course, if someone feels terrible on these medications, no doctor wants to like prescribe something that's going to make somebody feel bad. But in terms of long-term risks, I mean, again, we've used these meds for 2 decades at this point. And so, and when we start them, we intend for them to be long-term agents. These are not temporary, right? So we have enough data to suggest that these cannot be temporary either. So while for some folks, the weight gain might be more within the last few years of perimenopause and menopause, a lot of people have also dealt with weight issues their whole lives, right? Or since childhood, or since whenever at any point in their lives. And so we need to treat weight as a chronic disease. And so, it's not something that would be recommended to be prescribed, for 3 to 6 months, get the weight off, and then you're good to go. It doesn't work that way. So when we take off the medication, when we think about the way that the medication works, if we take off the suppression on the hunger hormone, well, there goes the hunger hormone, right? And so then the drive to eat, cravings, all those kinds of things would go back up. And so we do expect weight regain if people stop the medication.
Okay, that's super helpful to keep in mind. Um, One thing I love about Alloy is you're constantly checking in with your doctor, so adjusting your dose and taking a careful
Mhm.
look at what's happening with your body. That's just built into your support system.
Mhm.
A quick follow-up question. You mentioned this briefly, and this has been really exciting news recently,
Mhm.
is that there are oral doses coming out, like pill form.
Yeah, or
So,
Glipron. Yeah.
yeah, tell us what we need to know about that. What's sort of the emerging research here?
Yeah, so we actually already have an oral GLP, which is oral semaglutide. It's basically the oral form of Ozempic. It's called Rybelsus. So that's been around for some years now, but that's only approved for patients with type 2 diabetes. Orforglipron is also an oral GLP that's going to hopefully be approved later this year, coming out from Eli Lilly, but
Yeah,
that's also going to be approved for diabetes only right now.
gotcha.
And so, we are expecting good success with blood sugar control, A1C reduction, and obviously weight reduction as well. But a lot of the time, and this has actually happened with all of our GLPs, they've first been approved for diabetes management, followed by later weight management. And so typically there have to be, the way that FDA approval works, there have to be studies in the weight management space to show benefit. And that's where FDA approval has been seen from semaglutide and tirzepatide.
Awesome. Thank you for clearing that up.
Mhm.
For folks who are interested, I just want to put out there the medication options that Alloy offers right now. They include FDA approved Wegovy and Zepbound, as well as compound liraglutide. And all of those have transparent pricing. And we do our very best to address cost barriers. It's really important to us to democratize access to these medications for women who need them. Having said that, Dr. Narang, can you explain for those who are tuning in today, what are the differences between those different options?
So liraglutide is a daily injectable, whereas semaglutide and tirzepatide are weekly injectables. We actually don't, I mean, I will maybe just take a little bit of a detour. We don't have FDA approval for compounded GLPs. We have FDA approval for the patented GLPs. And so those would be Saxenda, Wegovy, or branded Zepbound. And so for those, again, like the Zepbound and Wegovy would be weekly injectables, and then Saxenda, which is liraglutide, it would be a daily. And that's a higher dose. If anybody, has had experience with diabetes, that's the higher dose of Victoza, basically.
Awesome. Thank you for saying liraglutide multiple times. I now
Mhm.
realize every time I've read it, I've been saying it incorrectly in my head. This is why we love talking to doctors. Um, let's go a little deeper on compounded medications. That's definitely been a hot topic. You just did a great job parsing out what the differences are. If a woman does want to go in that direction, what should they know about quality and sourcing if they're considering that?
Yeah, I mean, so I'm going to be perfectly transparent about that. There's been a lot of litigation in the last several weeks, and even in the last several months, from Eli Lilly and Novo Nordisk,
Yes, I've seen that.
towards compounding agents, pharmaceuticals, pharmacies, and just entities that are making compounded GLPs. And to be perfectly honest, we don't have safety or efficacy data on the compounded agents. And so, in fact, we've had over a dozen deaths associated with the compounded agents as well. In the last year or 2 years. And so, it's really important to make sure that, whatever wherever you are getting your advice, wherever you are getting your prescriptions, that you are getting branded medication, because there have been noted to be many impurities in the compounded agents as well. And we just don't know. I'm going to be perfectly evidence-based about this. We don't know what substances are going into the compounds. And so from a safety perspective, it's my obligation to make sure that, we are providing safe and effective care towards our patients and making sure that they're accessing the branded medication. Now, in the setting of the shortages of medication in the last couple of years, this is kind of where the compounding industry did take off. We're no longer in a shortage. And this is where that litigation has taken place, where, when there's no shortage, there's not an indication for the compounded agents. And so, be, discerning about what medications you are accessing. Especially they should have the branded, Eli Lilly Lilly or Novo Nordisk stamp on the agents. And so be sure to check in with your physician to make sure that you're getting the correct prescription.
Awesome. Thank you. And yeah, I think it's just worth discussing all of this right now because, as you said, so much is changing with the shortages, and
Mhm.
there's some new timelines in effect with all the different sources. But definitely it helped fill a gap. But you're absolutely right. It's most important to discuss the options and what's best for
Mhm.
you with your doctor.
Mhm.
Okay, final GLP-1 note here, since we've gotten so granular. At the end of the day, how can a woman assess if she's a good candidate for this type of medication?
Yeah. So I think it's really important to make sure that you are meeting with someone who's comfortable speaking about weight management. I don't necessarily believe that the medications should be doled out like candy because some patients might not be, great candidates for certain medications, whereas they might be better candidates for others. GLPs are not the only agents we have available for weight management. We have oral agents that are FDA approved, and of course now the injectables. But, some women might be a much better candidate for the oral agents versus the GLP. The other thing to think about is insurance coverage. This is a very significant rate limiting step these days in terms of patients' access to medication. And so out of pocket, these medications are about $500 a month. If your insurance covers it, lovely, but that's been a challenge because these are expensive agents. In fact, I think that, depending on kind of where you go, it's important to understand, like, am I being overcharged or am I getting, the correct pricing? So Eli Lilly and Novo Nordisk have their own pharmacies as well, where doctors can prescribe directly so that you do get the branded medication. Like I said, those are about $500 a month. And so it can get pricey. And so the important thing is with that is that, again, these are long term, right? So you've got to have a plan like, is this going to be a sustainable option for me? Because it's not necessarily something that we would say like, hey, take this for, like I said before, it's not something that you would say like, take this for a few months, get the weight off, and then you're all set. It doesn't work that way. And so you don't want that expenditure to be in vain. You don't want, all that effort and everything. Obviously the lifestyle stuff stays no matter what.
Yeah.
But the yo-yo circling of like the weight gain and loss is really hard for patients. And we saw that, right? Like in the shortages and things like that. Unfortunately, patients would come off the medication because there's no availability,
Yeah.
and then they'd regain the weight because they were off of it. And so, it's important to kind of figure out like, am I a good candidate? So per FDA guidelines, people with a BMI above 27 with a weight related comorbidity. So that means, prediabetes, sleep apnea, high blood pressure, high cholesterol, osteoarthritis. Those are potentially all weight related comorbidities, heart disease. Those people with those conditions with a BMI above 27 are eligible for anti-obesity medications, or people with a BMI above 30 without another weight related comorbidity would be eligible for an anti-obesity medication. And so per guidelines, those are sort of the accepted, BMIs for, prescribing medication. I would love to be able to expand beyond BMI because that's just not necessarily, at least in the weight management community, that's only one number. There's a lot of
Yeah.
other things that we look at, obviously, to understand somebody's metabolic health, like body composition and, all those other things. However, unfortunately, insurance companies are a little bit, behind in the way that they cover things. Same with, the FDA, right? So when we look at the indication for the medication, per FDA approval, those are the guidelines. And so, obviously there's always off-label care and things like that, but that's going to be a conversation with your physician.
Okay, awesome. Just one quick follow-up. You
Mhm.
mentioned when folks go off the medication, that yo-yo they experience if they decide to go back on.
Yeah.
You said that can be hard on them. Do you mean that like mentally and emotionally, or do you
Physically,
mean actually
mentally,
physically? Yeah,
yeah,
so your
physically,
body doesn't love that.
emotionally, yeah, all of the above, right? Because um easy example. And this is, unfortunately, now that we're not in the shortage, I think it's going to be a lot easier to access medication. But, there have been issues with insurances dropping coverage of the medication. And so, patients may have been doing great. And, and it's amazing. Like people literally sometimes feel like they're living their best life because they finally have a chance at increased mobility or, whatever they've been wanting for their life. They feel, like better. And so they were able to do those things, which is really fun to see as a physician. But what was happening was with the shortages or lack of coverage, they'd be forced to come off of it and the out of pocket, cost may be too expensive for some people. And so you slowly see, that weight come back up. And then then potentially we figure out how to gain access again, to restart, whatever. And potentially the second time around, it's not as effective. And that happens a lot, and so that's why I always say there's no secret to weight management. It's consistency. And so that means obviously consistency in lifestyle, but also consistency in treatment. Right. And so it's not necessarily something you go on and off of. But it is something that, when you plan to take something, the plan's got to be kind of a long-term thing.
Okay, that's super helpful. And just a note on the expense, because we were talking about that a bit
Mhm.
before. Folks know that this is being hosted by Alloy. Obviously, we are really committed and passionate about making this as affordable as possible to women. So I'm really proud to say that Alloy has relationships with the pharma companies, so they're doing everything in their power to make this as affordable and accessible as possible to women who might need it. I'm looking through questions sort of as we're going to make sure that we're hitting on them when we can. One that's come up a couple of times, and I hear this a lot in my daily life, is what if I just have like 10 pounds to lose? It's not enough. This person is asked to actually like probably go on medication. What would you say to that woman who feels like they're borderline? They're not sure if it's like an urgent medical thing, but they can't get the last 10 pounds off.
Yeah, and that's a very, common complaint. Again, this is going to require a specific conversation with your physician, right? Does that mean that there are other like secondary causes for weight gain, like thyroid or other, changes there that we can treat? And what, just as an aside, uncontrolled thyroid disease may allow for about 10 to 15 pounds weight gain. So if there is that 10 pounds, we want to make sure, obviously, is that due to something else like thyroid or whatnot. For 10 pounds, somebody might not be the best candidate for a GLP, right? There are, like I said, several oral agents available as well that could be just what this person needs to get them over the hump. But again, this is going to really depend on the person's profile, their past medical history, everything to understand, am I safe, for this medication? And, if that helps to get the person over the hump and they're feeling better, great. But again, it is, a long-term thing. And so coming off of whether it's the oral medication or, injectable, whatever that might be, coming off of it does cause weight regain. And so, but yeah, I mean, it's not a failure of anything you're doing to start medication. This is just an added resource that some people may need, to get them over the hump, and that's completely fine.
Cool. As long as we're talking about candidates for this type of medication, I'm seeing there are a couple other questions, slightly different. One is there like a certain amount of time you recommend that women like really commit to their nutrition as well as exercising more before they take it to this next step?
I think it's different for every patient,
Yeah.
right? And so every study that's been done with the medications has been in adjunct to a reduced calorie diet and increased physical activity. And so it's not like one versus the other. When we combine, a conscientious lifestyle with medication management, that's when we see success. And so, I don't think necessarily it's appropriate to withhold treatment from somebody until they prove to you that, they can do such and such exercise or various diet or that sort of thing. But again, I think it depends, like, how ready is this person to potentially be on it? Some people don't want to be on medication, and so they may want to just continue with lifestyle changes, and that's perfectly acceptable as well. I think it really needs to be like, okay, what works best for you as a patient, and what works best for you, from like a longevity standpoint as well. And then from, a dietary standpoint, I actually don't recommend like any fancy diets or things like that, because those aren't sustainable. Every
Yeah.
single patient who comes to see me has tried probably every diet under the sun, right? And the reason they often regain weight, one, obviously because our hormones just make that happen. And that's just, again, physiology. But the other is that it's very difficult to sustain a highly restrictive dietary pattern. So, it's going to be really tough to be just drinking protein shakes all day, or like, like a very restricted like type of diet. So you want to make sure that if you're looking at a dietary pattern, think to yourself, hey, am I going to be satisfied eating this way in 20 years? And if the answer is yes, then that's a good dietary pattern to stick to. Granted, like it's always a good thing to cut back on processed foods and things like that. But if you're eating a clean, moderate diet, that's the stuff that's actually sustainable, like into your 70s and 80s and all of that. And you could still hopefully maintain that satisfaction with food as well. You don't
Okay.
want to be resentful of that.
Awesome. Very helpful. And I love that response too, that you don't have to prove it to anybody, if this is really a need. All right, let's get into another topic that we get a lot of questions about and that many people attending today have already been asking in the chat, and that is the side effects of these drugs. So I know there can be some anxiety around that, and I also know that every single person has a completely unique body and is going to respond differently.
Right.
But can you start by sharing some of the side effects that folks can expect?
Right. So it's actually really tough to understand like what kind of side effect what patient will have, right? Some people feel absolutely nothing and they do great. And others might have, something like nausea or queasiness the first day that they take their medication. This is for the injectable agents. GI related complaints are sort of the number one side effect. And so that could be something like dyspepsia, which is just sort of acidity, right? It could be indigestion, it could be nausea, vomiting, diarrhea, constipation. Constipation is a common side effect that even when the nausea and things go away, the constipation tends to linger. But from my standpoint, I really work on, okay, are we getting enough dietary fiber? And I don't mean Metamucil. I mean like food with
Food,
fiber.
yeah.
Right. And so that really becomes an exercise in terms of making sure that you're getting adequate nutrition, through your treatment as well. But GI related side effects are the kind of the number one thing. Some people might, have increased like belching, for example,
Hmm.
fatigue. They may have like lower blood sugar type of symptoms, like hypoglycemic symptoms. Those tend to be the most common things. Some people might have injection site reactions as well. But as I was saying before, at the end of the day, we've seen these studies, and obviously with our patients as well, about 95 to 96% of patients actually can tolerate the medication at the end of the day. The patients
Okay.
that you do not want to give this to, especially the injectable agents, are going to be those with a personal or family history of medullary thyroid cancer or something called MEN2 syndrome, and that's very rare. I do want to make that point because this is a very, very common misconception, that people think, oh, I have hypothyroidism or hyperthyroidism, or I had papillary thyroid cancer and I can't take this. That's not true. You're perfectly safe to take this. Medullary thyroid cancer was seen in rats in the initial studies of the medications, but it's never actually been seen in humans. However, that's the one contraindication to taking it. The other contraindication is if you have gastroparesis, or just unstable GI disease, right? So if someone has Crohn's disease and they have like a lot of flares and they're not, feeling good on that, with the flares, then that they might not be a great candidate for a GLP medication. But all in all, most people tend to be pretty safe to take it. And then obviously in those who have previously had pancreatitis, we tend to practice a lot of caution with. In terms of the oral medications, typical side effects would be, and I'm thinking, like phentermine topiramate, or something like Contrave, which is bupropion or naltrexone. People could have palpitations, they could have tremors, they could have difficulty with sleep, dry mouth. But again, any of these treatments, we start at a very, very low dose and we go up very slowly as well based on how well the patient's doing. So there's no race to the top dose or anything. Take your time, get your body used to it. If you really don't feel good on it, then we stop.
Awesome. Okay, that's super helpful. One other side effect, and we've been asked about this in the chat, which I'm keeping an eye on, is about hair loss. So that's come up in some news stories. And full disclosure, and this is why I'm asking you too, I always thought that was related to nutritional deficiencies, like not getting adequate vitamins, et cetera. Am I totally wrong, or is that what's
Yeah,
happening?
even if you or anyone, even if someone loses weight from like any diet, let's say somebody loses 50 pounds from such and such diet, they're going to have hair loss. So weight loss in itself is associated with hair loss. It's not a medication side effect. And so even if you did this, without medication, you probably would have hair loss. And so you want to make sure then that you're getting appropriate nutrition. That's a big part of it, obviously. But hair loss is a common thing with any modality of weight loss.
Mic drop. Okay, that's super helpful. I think there's misconceptions about
Yeah,
that,
so
like
many, so many.
specific
That is
weight
not a
loss.
medication side effect. No.
Okay, cool. Good to know. All right, so sort of to wrap up this little section where we're talking about side effects, some nausea, constipation, perhaps some burping, maybe some shifts in how your energy is, and of course, keep a close eye on that injection site where you're administering your medication. um, I want to throw out there, this is again one of the benefits of working with a provider like Alloy, that you're in constant contact with your doctor. So if anything is worrying you or you're noticing some of those side effects, you have direct access with them to connect and make sure that you're managing it. And there are also anti-nausea medications that can help you feel more comfortable if that's becoming an issue for you. I guess last question, I said it was already the last, but I my understanding is that a lot of these side effects that you just talked us through, that they tend to people acclimate over time as their body adjusts to the medication. Is that true?
Yeah.
Yeah.
Yeah, and that's why again we start at the lowest doses and we stay on it for at least 1 month, if not longer. And so I typically will follow the patient's feedback. If they're feeling sick on the lowest dose, well, I'm not going to go up to the next dose. I'm going to stay at the lowest dose for another month or so. And so it's really important to kind of understand, how do you feel on it. And then some people maybe they feel off, or like kind of nauseous or whatnot, when they take the next dose up, maybe for the first dose or so, but then it levels out. But everybody's so different.
Yeah.
And it's really important to go at the patient's pace. Again, there's like no race to the top here. So, check in with your doctor, check in and make sure, if there is any way to mitigate those side effects as well. So for example, especially with GLPs, we recommend eat smaller, more frequent meals, eat blander foods. The greasy, fatty, heavy foods might not make you feel so good. And so people tend to crave sort of lighter, blander foods, especially if they're not feeling so good. And hydration, that's a big one. And so that might make a big difference as well. But part of it is when you don't feel so hungry, you don't want to hydrate, you don't want to eat. So some people, when they're really feeling it, they really kind of have to like make sure that they're kind of meeting their nutritional needs. The other thing, it might be helpful to take Tums, for example, because you've got like some indigestion or Pepsid or that sort of thing, and that's perfectly okay to do as well. And so, again, keep your doctor posted in terms of what your symptoms and things are. More likely than not, there's a way to mitigate that.
Okay. Wonderful. That all is great reassurance. All right, we've talked about diet. We've made it clear that there are foods and things you can eat that can make you feel more comfortable, but also that nutrition continues to be very important even after medication. I think it goes without saying, but these drugs are not a replacement for eating healthy. You still need all those vitamins and micronutrients and everything else we get from whole foods. But let's shift for a minute over to exercise, a topic that I am very passionate about. Um, Whether women who begin taking these medications already have a consistent exercise fitness routine, or whether maybe this is sort of the spark that really gets them into the gym and committing to that for one of the first times in their lives. I
Mhm.
was hoping that you could share with us why, particularly when you begin these medications, that it's super important to prioritize building lean muscle mass or protecting what you already have.
So outside of like perimenopause and menopause, we actually start losing muscle at age 30. And so resistance exercise and muscle build is important whether or not you're going to be on medication, especially as you do get into menopause and you're losing that estradiol and progesterone, you're going to lose more muscle. And so that goes without saying that exercise and resistance training needs to happen whether or not you're on medication. And again, like this sort of goes to some of the things that have been sort of buzzing around in the media, that there's a lot of muscle loss and whatnot with medication. Not true. So we've seen now in several studies that there's actually more fat mass loss than lean mass loss with the medication. um Again, just like the hair loss, any kind of weight loss will lead to muscle loss. And so regardless of what your, path is, whether you're on medication or off, the need for regular resistance training is imperative. And so, that's something that I would recommend no matter what. And so, if this is feasible to somebody, potentially getting a trainer, so that you can go through something safe in terms of, I just don't want, I hate making people injure themselves, right? So you want to,
Yes, agreed.
what's safe, go through, what's safe with a trainer so that, you're not injuring your back or whatever. But even, let's say you walk a lot for exercise already, maybe consider adding on a weighted vest, maybe consider adding ankle weights or wrist weights just to up the ante a little bit and increase your muscle work. So all of that stuff counts. It might not feel like, you're doing something big, but it actually does all add up. So, if you're going to be walking your dog or your child or whatever in the stroller, put on some ankle weights, it's just added resistance. And so the big thing to really think about, am I getting appropriate dietary fiber and protein, of course, but the protein, especially in the setting of weight loss, is a substantial amount. We recommend 1.1 to 1.2 grams of protein per kilogram of ideal body weight. And so for most women, that ends up being about 100 to 120 grams of protein per day. So that's quite a bit. And sometimes it's not the easiest to get all that. But with that comes, resistance exercise. And so that is something that, like, I think people have to start to get into the habit of, like, how much resistance exercise am I going to be doing week by week? But like I said, it can start with something as simple as strapping on some ankle weights and going on a walk, or getting on your walking pad at home while you're watching TV or something at night and putting some ankle weights on, or something like that. Get some resistance bands for your office. Like, it doesn't have to be something crazy, but any little bit will count.
Okay, cool. I am very passionate about this as somebody who's gotten really into strength training
Hmm.
soon after I turned 40.
Hmm.
First of all, it's so empowering and so
It
fun
is.
to watch your weight progress and to be able to
Yeah.
lift heavier and heavier weights. I completely agree with you. Please, nobody go out and start picking up the heaviest weights at the gym. Like, start gently, start
Start small.
slowly.
Yeah.
Let your body adjust.
Yeah.
But you are doing so many powerful, good for you things in your body every time you pick up a weight. Also, one more tip I have to throw out there for those who don't already have a weighted vest, or the strap-on ankle weights or wrist weights. If you have a backpack at home, put some books in it and, like, put it on while you're walking around your house, or like you said, when you go walk your dog. There's a lot of tools many
I
of us
love
already
that.
have in our lives that yeah, just make it really easy to get in some of that bone density building and muscle building exercise that's so important when we're in this in this time of our lives. And then last note on this, because I'm working on it with the rest of the team at Alloy, we firmly believe that all of these lifestyle modifications that support you during your weight care journey are essential. So we've developed tons of resources with the menopause trained doctors and clinicians at Alloy to really like walk you through this, even with some simple training plans and nutritional guidelines, et cetera. So we've got you covered. Do not worry, we'll be here to support you. Okay, I can't believe we're already three-fourths of the way through. I'm gonna power through just a few more questions and then make sure you didn't
Sure.
miss any
Fire
more in the chat.
away.
There are so many. One big question I wanted to ask you about that I've been so curious about, and new research has just been released on this, is for this population of women who are on hormone therapy and then add GLPs. That seems to be a really productive synergy when you add the two of them together, and their weight loss results appear to be even.
It,
No. Okay,
yeah, I
tell us
don't
more.
I don't think there's necessarily synergy, but I think the fact that someone's on HRT allows them the ability to focus on the weight management portion of it, because HRT itself does not lead to weight loss. But it
Right.
might allow for a decrease of hot flashes or improvement in your sleep cycle, or decreased discomfort in like the joints or muscle aches that might allow you to exercise a little bit more. It
That's what I
might
was going to
the
say. If you're
energy. Yeah.
not sleeping because of hot flashes, of
Yeah,
course you don't want to hit the gym tomorrow
exactly.
morning.
And so
So
that's the level of synergy like I would refer to, but there's not
got it.
actual synergy between HRT plus GLPs.
It's
But
like it's a link because there's a
yeah,
halo effect or something.
exactly. And so I think for women who are benefiting from HRT, they're able to focus or channel that energy into, the weight management portion of it, because they don't have to be up all night like sweating like crazy and all of this. And so I agree with you. I think that for those who are good candidates for HRT, I'm all about it.
Amazing. Okay.
Mhm.
I have a few final questions for you, but
Yeah.
first I want to ensure that I'm getting to the most common ones in our chat. Um, okay. Wha- Um, uh, Macro counting. I feel like we got into that. 100 to 120 grams. I'll just throw that out there as somebody who's also been on a protein journey. Yes, that number, once you start looking at nutrition labels, you're like,
Right.
what the heck? And especially when your appetite is undergoing these changes, that seems like a lot. But I know nutrition is a passion of yours. Like, what do you tell the woman who's only eating, and this was me, full disclosure, 5 years ago, like 40 grams of protein a day? How in the world do you go from 40 to 100? I think
Yeah.
that's really common, actually.
I agree. And I think, it's a little bit of an exercise in becoming mindful about what you're taking in. Um, you're not going to go from 40 grams to like 120 grams tomorrow, but I think it's partly, trying to understand, okay, what are other sources of protein I can take in? I mean, I think especially for folks who are vegetarians, people think that there's not enough protein options, but there really are. You just have to plan ahead and make sure, that you're getting all those sources. But yeah, I mean, I think it'll be little by little. You kind of have to train your body to be able to accept that kind of volume, right? And or it might be something like a protein shake, and that's what you start off with, and that tends to be kind of more concentrated in protein. And if you're full with that, and you're adding, maybe you could add some spinach to it, maybe you could add a couple other veggies or fruits to it and make it kind of like a wholesome meal in that way. But honestly, like, everybody has to like approach that in a mindful manner and plan out, like, okay, this is how I'm going to get this level of protein. It just doesn't happen overnight just because someone wishes it to, right? So you have to be super intentional about it and plan what I'm going to eat, what day, what meal, all of that. And that's how it eventually does become second nature, but it takes a little bit of practice to get there.
Yeah, I found the same. I just started monitoring what my normal week of eating looked like without
Yeah,
changing anything, and then really it's like adjusting to looking at nutrition labels and
absolutely.
using chat gpt to be like, how many grams of protein are in a hard-boiled egg? And then pretty quickly it starts to become second nature. You don't have to
Exactly.
like measure and
Exactly.
weigh, you just can
Yeah.
eyeball. um
And I actually don't recommend measuring and weighing because I think that's
Okay.
actually really anxiety
It
provoking.
is. It's a
Yeah,
lot.
so quality over quantity, you know, and so if it's like approximately like a piece of meat the size of your fist or like the deck of cards size, you're getting about 20 to 30 grams of protein in that serving. Fine. I don't think we need to create so much toxicity around these sorts of numbers because I think it does really create anxiety and sort of that diet toxicity that diet culture, all that, not, we don't want to do that. We're all about healthy living. We want to eat well. We want to, be happy with what we're eating.
Yes, we want our lives to be low maintenance. They're already
Yes, yes.
enough without getting out food scales.
Yes.
This is related. There's several questions that have come in around supplements. One person asked about creatine and another about essential amino acids. I've done a lot of research into these.
Mhm.
I'd love to hear your thoughts on both, particularly creatine is kind of its own topic adjacent to this, but essential amino acids, are those helpful for people? Not really. You're not into them. Oh no, you're blowing up my whole worldview. Okay, good. Tell me more.
There's no data, right? Like, so, so supplements again are not FDA regulated. Supplements are considered a
True.
food. And so there's no data to suggest taking extra essential amino acids is going to change anything in your trajectory. If you can eat a moderate diet that is covering, all the basic food groups, you're getting those essential amino acids. And so it's not.
So BCAAs, aminos, collagen, et cetera, that because they're very expensive too.
They are expensive. And I think, again, like, the supplement industry has made a lot of money off of this stuff, right? And again, like, go in with a discerning eye. We have no evidence to suggest like these sorts of supplementations change anything in someone's weight trajectory, longevity trajectory, any of it. What does change longevity trajectory is exercise and an overall healthy diet. Right. Obviously, we can't change our genetics, but if we're mindful about what we're doing day to day about this sort of stuff, without breaking the bank, and you really don't have to break the bank, right? Yeah, go enjoy the grocery store and all that has to offer.
Heard loud and clear. And we need to do a side conversation about this because, like I said, this
Yes.
is this is blowing my mind. Okay, we're also getting some questions about microdosing. Uh,
Mm.
and is that something when somebody's been on medication for a while? Well, actually, two questions. To talk about microdosing and also when do you know it's time to go up or down in
In the dose.
dosage? Like, how does your doctor know when that's
Yeah.
you're ready?
Let's talk about that question first. So,
Okay.
typically, we start with the introductory doses of, again, I'm talking about orals plus GLPs at this point, but we start those for at least a few weeks. So for the GLPs, it's 4 weeks at the lowest dose. Every dose is at least for 4 weeks. For Wegovy, which is semaglutide, it is 0.25, 0.5, 1 milligram, 1.7, and 2.4. Per insurance, 1.7 and 2.4 are considered the maintenance doses, even per the studies. So basically, like, if you're under an insurance policy regarding, with these medications, they're going to have you go monthly up to the 1.7, and then you can stay at the 1.7. If you feel like, okay, my weight is plateauing or my hunger cravings are coming back or that sort of thing, then you could go up to the 2.4 and then you stay there. Um, if if this wasn't the case where they, people would, or the insurance companies would force you up, some people are doing well at the lower dose, 0.5 or 1 milligram or something like that. um we potentially, someone could still have benefit at the lower doses. However, if they feel like their weight is plateauing or hunger is going up, it is advisable to go up to the next dose up after at least 1 month on the dose lower. So that's how we decide, whether we're going to go up or not. In the oral doses, it's about 2 to 4 weeks at each dose. And again, like, there's no race to the top here. So if you're doing well at the lower dose, and with Zepbound, which is tirzepatide, 5, 10, and 15 milligram doses are considered maintenance doses. So if you're doing well on 5 milligrams of Zepbound, stay on it, right? And if you feel like, okay, after several months on it or something like that, again, weight is plateauing, hunger's going up, then you could go up on the dose. And that's sort of all like across the board. That's how we manage that.
Okay, cool. And
Mhm.
then quick
Oh, the microdosing.
microdosing.
Yeah.
Somebody asked like, oh, if I have arthritis, again, now we're sort of talking about off-label uses, and I know there's
Yeah,
emerging
that's
research.
not, yeah, that's not really accepted, at least
Okay.
like in the weight management community, because each dose is considered to be a one-time dose, like whether it's the vial for Zepbound or it's the pen, it's a one-time use pen. And so, other ways of doing it, you're actually potentially increasing the risk of contamination. And you don't want to necessarily do that. So there's always a risk there. So you want to be careful about how, you're extracting the medication, I guess.
Okay, cool. Thank you for clearing that up. Um, I want to be sure I follow up on this question, and I'm sorry, I'm not going to be able to get to all of them, but I wanted to let everybody know, follow Alloy on social media. We're doing another weight loss focused webinar with another amazing doctor next month. So we know there are a lot of questions that we can't get to every single one in an hour. So please come back. And the question I wanted to follow up on was, what is resistance training? What does that mean? Those are weight-bearing activities, right? And there's just like 5 or 6 simple movements that you could do at home. Add dumbbells once your strength improves, like lunges, squats, overhead presses, anything you want to add on this front.
Yeah, I mean, so actually, so weight bearing exercise so we talk about that a lot in like with osteoporosis, especially because with endocrinology we see that often. So weight bearing exercise actually means using gravity to like let your bones work, right? So that gravity actually keeps your bones strong. So that means walking, running, dancing, like using your feet. So for
Thank you.
example,
Yes.
swimming or biking is not considered weight bearing exercise. However, you could still get resistance training from something like swimming or bike. So if you're biking up a hill, that's resistance. Or if you are, I don't know, wading water against weight or something, that's resistance. So when resistance training is like training your muscles to work harder, to
Yeah.
be able to tolerate greater amounts of resistance or weight. And so
It's a
that
muscle stimulus.
yeah,
Yeah.
like muscle strengthening basically. And so that's where, when we were talking about adding on like a weighted vest or ankle weights or whatnot, basically you're adding those weights on. And so your muscles are working harder. And that's exactly what resistance training is. And it could be something like even 2-pound dumbbells that like you lift during a meeting, when you're, and I think like remote work really allows for increasing activity around your workspace. So if you feel like you're sitting at a desk all day, create a workspace more conducive towards activity, right? Does that mean that you're going to stand more? Does that mean that you're going to get a walking pad during Zoom calls or, any of that? And so, again, yeah, you don't have to go and lift 50 pounds tomorrow, but like, even if you do 2 pounds, like a couple times a day or something like that, that counts.
Cool. I have a lot of friends who call it exercise snacking.
Yeah, I love
They'll like
that.
get
Yeah.
up every hour or two
Yeah.
with their weights or their bands, or even just with their body weight, do some movement,
Yeah.
which is great, and a whole cascading
It
benefit,
could be push-ups
waterfall of
on your
weights.
desk, right? Like
Really.
anything. And so you don't have to have a fancy gym to do all of this. And I think people sometimes get inhibited by the fact that like, oh, I gotta now go and weight train at a gym and things like that. You don't have to do all that.
Yeah.
Save your money if that's something that's an issue. And but you can still get quality exercise without it.
Awesome. Okay. In the last few minutes, I'm going to do sort of a turbo round with you, just a few final questions. So we have all of these women who've tuned in today. Thank you again, everybody, for your time. Let's pretend that Dr. Narang is your doctor, physician, and you're speaking to us. I know we're not actually your patients right now, but channel what that type of heart to heart would feel like or look like. What do you say to a woman who comes to you and is just frustrated and feels stuck with weight gain? Like, what's the
Yeah.
first thing you say?
You're not alone. I'm really glad you're here because I can help you, you know? And I think that there's a level of hopelessness that I think a lot of women feel when they're sort of in this journey. And that's where I love these sorts of conversations and like this sort of platform because people have people have a resource now, right? Whereas like our moms, for example, were sort of told to just suck it up and deal with it. And so we have evidence based, we have, you know, things that can actually help people feel better. And I always tell patients, like, my goal is not for you to be on the cover of Sports Illustrated. I want to prevent diabetes and heart disease, and I want you feeling better, and I want you feeling stronger. That's what's going to let you live until like 9,500, you know? And so part of it, you know, and I think it is motivating to see those results, but I think it's also important to know that, you know, this is also a different body and that's okay. And aging is part of the process, and it's okay for us to accept that as well. So when we balance those two things, that's where I think it takes like the onus off of like, oh my gosh, I look this way now, or I feel, you know, that sort of thing. But the important thing is like feeling well and living well. And, you know, when we do that, all of those things I think come into line a little bit. And the other thing is managing stressors, right? As women, we're carrying the weight of the world on our shoulders. So many people are working, you know, full-time jobs or more, managing children, managing parents, right? Like sandwich generation. And so I think managing stress is a big part of it. And if exercise is your, you know, avenue for stress release, lovely. But it's important to figure out like, how am I going to take some time for myself to maintain my sanity? And I think all of us who could, you know, who are in these like ages can probably relate to that, right? And it's okay to take that time out to nurture that sanity, right? And it all comes together. So yes, we're talking about weight and menopause, but all these other things contribute, you know, to all of it. So it's comprehensive, right? And we have to look at the whole woman to be able to treat her appropriately. So that's kind of my angle here.
I feel like I was just given a warm hug.
Aw.
That's very reassuring. Okay, last question. What most excites you about this new chapter that we're all living in for women's healthcare?
Yeah, you know, this has actually been for, I think the last 2 years I've been thinking this because menopause is having a moment, right? And we're not sitting back and dealing with it. And I love that, you know, and the fact that we are seeking out resources, that we're becoming our own health advocates is really, really important. And I think, and I mean, I hate to say it, 'cause I'm a physician. There's a lot of gaslighting in healthcare too, right? And so I think it's okay to say like, no, you know, this is how what I'm struggling with, and it's okay to seek out appropriate care to that, right? And find somebody who will be in your corner, and I think that that's really important for someone's wellness journey.
Awesome. Thank you so much. I am very grateful to you for your honesty with every question, to the intelligence and experience that you've brought from your career and practicing with patients every day, and perhaps most of all, the deep compassion I felt for women who
I
are
love what I
navigating all of
do.
this. It's very obvious. I also want to say to everybody who took the time and energy out of their very busy lives, as you said, to tune in today, to listen, to be curious, and honestly, just to take charge of your own health by learning more and by devoting yourself to this journey. I really appreciate you all showing up. And finally, I just want to say, you know, we talked a lot about how every single woman is different, every body is different, every situation is different, and we are very lucky to live in this world where we do have access and tools and platforms that are built to support you in your unique journey. So I hope that you know, those of you who need it or want to learn more will stick with us at Alloy. We'd love for you to meet with one of our clinicians and to learn more, whether it's hormonal shifts or the metabolic shifts, or just simply wanting to connect with other women and getting that support. So thank you so much, Dr. Narang. It was a pleasure to get to know you better and to chat about this. And
Thank you so much for having me.
I'll see you soon, and I hope to see everybody else who tuned in soon.